Thank you for choosing McLaren Greater Lansing for your surgical procedure. This video will give you a brief overview of what you can expect on the day of your surgery. Part of your surgical preparation begins at home. Be sure to remove nail polish, artificial nails, rings, and valuable jewelry prior to coming to the hospital. Please do not wear makeup or lotion on the day of your procedure. If the surgeon ordered a special skin wash, ingestion of certain medications, or other pre-surgical preparations, complete these items at home prior to coming to the hospital. If you wear a special respiratory device at night, a CPAP or BiPAP, please bring this with you. It may be used during your hospital visit. Lockers are available on site to lock up your clothes and personal belongings as needed. Enter our hospital parking lot off of Greenlawn Avenue, which offers free, convenient parking in front of the main lobby. If a patient or family member has difficulty walking, they can be dropped off in the designated drop-off area. Once in the main lobby of the hospital, you will see one of our patient greeters at the admitting desk who can help direct you. You will need to visit with one of our registration representatives to complete the registration process and confirm your insurance information. Make sure you bring your picture ID and insurance cards with you. If you have completed the pre-registration process prior to your day of surgery, the admitting desk can escort you directly to the second floor to continue the check-in process. Once you've completed the brief registration process, you can have a seat in our comfortable waiting area until staff is ready to escort you to the second floor surgical services area. If you need to have labs drawn or an X-ray taken, please know that it may take extra time to complete these services before you go to the surgical waiting area. The elevators that you need to take are located just past the lobby on your left. After reaching the second floor, turn left and then follow signs to the surgical waiting lounge. The pre-op area is also known as same-day surgery. A registered nurse will come and escort you to a private bay to change into a gown and to begin preparation for surgery. We are the first hospital in our region to offer the Bare Paws gown, a specially designed pre-warming gown which provides a feeling of comfort while also keeping your body warm and temperature regulated throughout your patient care experience. If your surgeon has requested you to bring X-rays or a DVD with images on it, please inform the staff as you arrive. The surgery team will need them during your procedure. Once you settle into the pre-op environment, an IV will be started and a review of your history and physical will be completed by the nurse. At this time, you can have a visitor join you until we take you back to the operating room. Communication is very important at every stage of your surgical visit. It is in the pre-op that you will meet your surgical team, including your nurses, your surgeon, and your anesthesiologist. Your surgeon will mark the site of your surgery and ask you a number of questions. These questions may seem repetitive, but we ask them to assure that we are providing the safest care possible for our patients. When your operating room is ready, someone from the surgical team will come to get you and safely transport you to the operating room. Once you are resting comfortably in the operating room, the nurses and anesthesia provider will connect you to a number of monitors, and when the anesthesia medicine has taken effect, your surgery will begin. It is very important that a responsible adult stay on campus during your procedure to be available to the surgeon and surgical team if needed. This person should check in with the volunteer at the surgical waiting lounge desk and communicate if they leave the lounge and when they return. This will help in locating your guest or family member when the surgeon needs to speak to them after the procedure. During your surgery, your family member or friend can track your progress. Each patient has a unique number assigned to them during the check-in process. A quick look at our surgery tracking monitor will tell your visitors where you are and if everything's on time, while still maintaining complete confidentiality. Your post-surgery care will include waking up in the post-anesthesia care unit or PACU. The specially trained nurses in PACU will monitor your vital signs and manage your pain as needed while the anesthesia medicine wears off. The RN will call your family with a progress report as needed. If you're having surgery that requires you stay 1 night or more, once you are awake and have stable vital signs, you'll be transferred to a post-surgical unit where your loved ones can join you. Visitors are generally not allowed in the PACU, with children and special circumstances being the only exceptions. If you're having outpatient surgery, you'll wake up in the recovery area and be transferred to our special discharge area. Again, specially trained nurses will be monitoring your vital signs to ensure your safety. When the anesthesia medicine has worn off enough and your vital signs are stable, you can have a visitor join you. McLaren Greater Lansing offers convenient prescription services. During the waiting period until you are discharged, the nurse can arrange the outpatient pharmacy to fill the surgeon's prescription, and the medications will be delivered to you personally. Once the registered nurse determines that you're ready to go home, they'll give you important instructions about your care and arrange transport to your vehicle. This completes your virtual tour of our surgical services experience. Thank you for choosing McLaren Greater Lansing.